Welcome to This Explainer. If you're tuning in today, there's a really good chance that you, or maybe someone you love, is starting to look into fertility treatments. And let's just be totally honest right out of the gate, taking those very first steps, it can feel incredibly daunting. Suddenly you're hit with this literal alphabet soup of medical acronyms, a pretty heavy emotional weight, and what feels like an absolute mountain of questions. It's so normal to feel lost before you even get started, trying to decipher clinical protocols while managing your own hopes and anxieties. But I want to reassure you right here, right now, you are absolutely in the right place. Today, we're going to break down the options at ART Fertility Clinics into clear, manageable pieces. We're going to trade that initial confusion for real clarity so you can walk forward feeling confident and supported. So are you feeling completely overwhelmed by all the fertility options out there? Honestly, if you're nodding your head yes right now, I want to validate that feeling immediately. The sheer volume of information on the internet is just staggering. You've probably spent hours down late-night search rabbit holes, right? Scrolling forums, reading advice that totally contradicts itself, making you feel like you need a medical degree just to understand your own body. It is a heavy, heavy load to carry, and it's entirely normal to feel like you're drowning in all those details. But the amazing news? You don't have to carry it alone, and you definitely don't have to figure it all out blindly. Okay, let's dive into this, and let's transition away from that feeling of overwhelming anxiety and move toward a journey of structured, actionable hope. There's a guiding principle from the incredible team at ART Fertility Clinics that I think is just profoundly reassuring. It says, once the exact cause of infertility in a female or male is diagnosed, the chances of a successful pregnancy increase dramatically. I mean, really think about how powerful that statement is. So often couples get stuck with that deeply frustrating label of unexplained infertility, which kind of leaves you feeling helpless, like you're fighting this invisible enemy. But finding the exact cause, that shifts the whole game plan. It takes us away from general anxiety and points us right at a clear, medically sound target. You aren't just guessing at solutions anymore. You're looking for a highly specific answer. And once you have that diagnosis, your odds of success, they completely change for the better. So, the crucial point is that fertility treatment actually follows a highly logical, guided progression. It is absolutely not a guessing game. The patient journey usually maps out across three structured steps. It kicks off entirely with step one, an accurate diagnosis for both partners. And we aren't just talking about a quick checkup here. This involves comprehensive blood tests for hormone levels, detailed ultrasounds, and even advanced genetic screening to get the full picture of your reproductive health. From there, your care team might suggest step two, which is supportive first-line care, like IUI. And if that isn't the right fit or you just need a bit more support, the path logically moves to step three, which encompasses advanced care techniques, things like IVF and ICSI. Let's actually look a bit closer at what those terms really mean for you. Let's start by totally de-jargonizing IUI, or intrauterine insemination. When you strip away all that clinical-sounding terminology, it's simply the process of artificial insemination. It is so often used as a really supportive, accessible first step in a couple's care. Think of it kind of like giving nature a very gentle, helpful nudge. Sometimes, the timing is just a tiny bit off, or the journey for the sperm is just slightly too difficult. IUI just bypasses some of those natural roadblocks by getting the optimal, concentrated sperm exactly where it needs to be, right at the perfect time in a woman's cycle. It's minimally invasive, it's super straightforward, and for a lot of couples, this gentle intervention is literally all the support they need to achieve a successful pregnancy. Now, what's really interesting about this slide is how we can break down IVF, or in vitro fertilization. That Latin phrase, in vitro, sounds super intimidating, right? But it quite literally just translates to outside the body. That's it. So IVF simply means fertilization happens in a wonderfully safe, carefully controlled laboratory setting instead of inside the human reproductive tract. And why is that so incredibly effective? Well, because bringing the eggs and sperm into a highly controlled lab completely removes a whole host of unpredictable biological variables that can cause natural conception to fail. The embryologist can monitor the exact environment, making sure the temperature and conditions are absolutely flawless for an embryo to form. When you ditch the Latin, the whole concept feels way safer, much more clinical, and honestly, a lot easier to wrap your head around. Then, we have ICSI, which stands for intracytoplasmic sperm injection. Now, this is a highly advanced, super specialized technique. And the key takeaway here is its specific purpose. It was developed specifically to overcome male infertility that's attributed to impaired sperm. For the longest time, the burden of these treatments unfairly fell disproportionately on women, even when the underlying issue was a male factor. But investigating the male partner's reproductive health is absolutely just as crucial. Highlighting ICSI ensures we're balancing the scales and looking at both partners. It's this powerful, highly targeted solution for men who might have a low sperm count or poor motility, making sure both partners get the exact medical support they deserve. And this brilliantly illustrates a really common point of confusion for patients, understanding exactly when to use IVF versus when to use ICSI. When you see them side by side like this, the distinction becomes crystal clear. IVF is the broader, more general laboratory fertilization process. Eggs and sperm go into a dish, and nature basically takes its course, just in a perfect, controlled environment. ICSI, on the flip side, is a highly specific, advanced injection technique. A trained embryologist literally evaluates the sperm, handpicks a single, structurally sound one, and injects it directly into the center of the egg. It's used specifically when the doctor determines the sperm's quality or movement is just too compromised to penetrate the egg on its own. Understanding that difference makes your doctor's recommendations suddenly make total sense, right? But hey, knowing the tools is only half the battle. How those tools are actually applied is what truly makes or breaks the journey. Which brings us to the philosophy of Prof. Dr. Human Fatemi from ART Fertility Clinics. He fiercely emphasizes the absolute power of personalized treatment. The major takeaway here? These treatments, whether we're talking IUI, IVF, or ICSI, are absolutely not one size fits all. A successful approach in modern fertility medicine means your care plan is meticulously tailored to you. In a clinical setting, personalized treatment means customizing the exact dosages of your stimulating hormones, adjusting your retrieval timing down to the literal hour, and designing specific protocols that respond perfectly to how your unique body reacts. You are never, ever just treated like a number or handed some generic script. Let's move to and see how this builds into practical steps you can take today, right from the comfort of your own couch. ART Fertility Clinics actually offers several completely free online fertility calculators. We're talking a BMI calculator, a calorie calculator, an ovulation calculator, and even a pregnancy due date calculator. Now, you might be wondering why a calorie or BMI calculator matters for fertility. Well, your diet, weight, and nutritional intake have a massive, profound impact on your body's hormonal balance and overall reproductive health. By providing these fantastic low-stakes tools, you can start gathering your own data, optimizing your baseline health, and literally taking control of your tracking today, long before you even step foot in the clinic for that first consultation. Now, when you are finally ready to take that next step and seek professional guidance, accessibility is absolutely key. Treating fertility involves frequent clinic visits, so location really matters. ART Fertility Clinics has specialized centers right across the UAE. They're in Abu Dhabi, Al Ain, and they have 2 central spots in Dubai, Jumeirah 3 and Dubai Healthcare City. It is incredibly reassuring to know you don't have to travel across the globe to find answers. World-class expert help equipped with state-of-the-art laboratories and renowned specialists is comfortably within reach, right in your own region. That alone removes a massive layer of stress from the whole process. Wow, we have covered a lot of ground in this explainer today. We started with that initial heavy feeling of overwhelming confusion, and hopefully we've moved toward a place of genuine clarity. You now understand what options like IUI, IVF, and ICSI actually mean, how they differ, and why personalized care is the absolute anchor of a successful treatment. You've got the foundational knowledge, and you know exactly what tools exist out there for you. So I want to leave you with this final, vital question. What will your personalized path to parenthood look like? The next step is simply turning all this new understanding into confident action. I highly encourage you to reach out, book a consultation, and start charting your very own unique course. Thanks so much for joining me for this explainer, and I wish you the absolute best on your journey.